Hey, Lexington. My name's Kevin Hall. I'm the communications officer for the Lexington-Fayette County Health Department, and I'm joined today with John Moses, who oversees our harm reduction program, among many other titles that John has here, and in what he's done with this program. We're here today to give you a little bit of an idea about what to expect next week, August 26th, for our big 5-year anniversary celebration. Cannot believe it has been 5 years. We're a little bit early. Technically, the anniversary date is September 4th, but we wanted to have it on August 26th because then all of our people who are currently working that program will be available. So today we're going to spend a few minutes talking to you, give a little brief recap of how this thing got started. We're going to tell some of our favorite stories and reminisce a little bit about where we were 5 years ago. So John, first, just if you could just tell our viewers a little bit about what you do with our harm reduction program.
Sure. I'm the team leader for Harm Reduction Services, and I supervise the staff that conducts our syringe exchange program, as well as our naloxone distribution program, HIV and hepatitis C testing, and then referrals to treatment that we also make through our harm reduction services.
And John, 5 years ago, when we were planning this, when it started in March, it started in January and February of 2015. Our planning internally started in March and then launched in September. Did you have any idea then how involved you would be and how this program would grow?
I did not. At the time, I was working in infectious disease and I was strictly doing HIV testing and doing disease intervention work, tracking syphilis cases and things like that. But I went to this conference down in North Carolina and learned so much about harm reduction. And I knew, oh my gosh, this is what we need to be doing. And it just so happened that our commissioner at the time was thinking the same thing, and everybody was working on getting this program together. I never dreamed that it would grow into what it has now. I can't remember. How many people did we have that first day, Kevin?
It's hard to believe that we started with just 9 people that first day and have grown to how many did we have last week on a day?
Sure, we're averaging well over 100 people a day. The last 5 months, due to COVID especially, we've seen a steady increase. We saw over 1,750 participants last month.
You know, you mentioned the commissioner at the time, and I got cold chills, and it's always happens when we talk about it, the late Dr. Rice C. Leach. Dr. Leach, when we started this planning, had one thing that he kept reminding us is that you got to start small, build the trust, and then you grow, because he knew that if we tried to be too much too soon, this program wouldn't be successful. And think back, John, to those first days. These are people coming in seeing that, hey, I inject a drug and I'm coming into a quasi-governmental agency. How do you account for people coming in like that? How did we build that level of trust? For one, I don't go to a new restaurant until they've been open at least 6 months, and that's with cheeseburgers, not needles and injecting heroin or anything like that. So talk a little bit about those first few people and the work they did in helping it
Sure.
work.
Yeah, absolutely. We prepared for hundreds of people to show up that first day. We were ready. We had staff. We had treatment counselors. We were ready to go, and we opened the doors, and we saw 9 people that first day. And we were like, oh, we saw 9 people. But then we were like, yeah, we saw 9 people came in here and did just what you described. I'm here. I use drugs, and I need some clean needles. But the big thing was how we treated those first few people that came through the door, because we knew that they were going to go tell all of their friends exactly what the experience was like. And so it was very important from day one that we treat people with dignity and respect, that we make sure that we build that trust with them. And over time, they told their experience at the health department, and now we are seeing record numbers using our services.
And it's worth reminding people that from the very beginning, 5 years ago to currently, the purpose of this program is to stop the spread of HIV and hepatitis C. Unfortunately, just north of here, I guess northwest of here in Indiana, there was an outbreak, probably about 15 minutes from Louisville in a place called Austin, Indiana. If you're not familiar with it, Google it, look it up. It's fascinating and frightening, and terribly frightening. And that led to Kentucky, the General Assembly, passing the ability for health departments to have needle exchange programs. So again, it's to stop the spread of hepatitis C, HIV, but there have been other things that come from this that similar. For example, the harm reduction program. We have naloxone used to reverse opioid overdoses. We have, and it's not a major piece of this. It's not the primary piece of it, but it is, if you will, it's a wonderful bonus. People can get on-site referrals into rehabilitative programs. John, how many people so far have taken advantage of that? Do you know that number?
Oh, yes. We've seen the last count was about 312, I think, of people that have touched treatment and that we've referred. Since July of last year, we've done 336 HIV tests, about the same number of hepatitis C tests. And we are distributing naloxone or Narcan at a rapid rate. We have multiple grants. We want to thank everybody who has contributed to this program, because it's not just me and it's not just my fantastic staff that is doing this. It's the Department for Social Services, and it's our treatment providers, and it's our relationships with UK that allow us to do all of these services. We have, since the beginning of the program, taken in 1.8 million needles that we've distributed or that we've disposed of in a proper manner. And so I could sit here and name probably 24 agencies that help and that provide us assistance. I won't go into those now. I would hate to miss somebody, but feel free to leave in the comments if you've been part of this program. We would love to hear from you, and hope that you can celebrate with us when we have our celebration for our 5-year anniversary.
And that celebration is going to be right here on Facebook, 1:30 on August 26th. And if you can't join it live, it'll be available for people to watch after the fact. We're going to try to get it on our YouTube channel. But let me say something, John, about one of the things that you did that was so important when we launched this, because whenever Dr. Leach would get too big talking about the numbers, or any of us would talk about what the data said, you would remind us that this is important. But we have to remember, these are real people. These are loved ones to somebody. It's somebody's mom, somebody's dad, somebody's husband, wife, whatever the relationship might be. The people coming in to use this program are people, hard stop. And that's something that, as you mentioned, the dignity that and the respect that we treated people with from day one to day, whatever times 5 is, I can't do the math off the top of my head, but to where we are now, it's always been, people have been treated with dignity, with respect, no matter who they are coming into our program. And you've mentioned too before to us, to me, to reporters, to anybody who will listen, it's also the first time some of these people who've come in have seen even the inside of a healthcare system. The first time they've had any treatment of or any sort of connection to health. Can you talk a little bit about that as well?
Sure, absolutely. People who inject drugs often experience isolation, and they are stigmatized, and a lot of them haven't seen a healthcare system in a very long time and fear the healthcare system. They fear being judged. They fear having to talk about their drug use. And you're right, we've been able to help people trust a healthcare system again. We are getting them in the door and doing so much more with them besides just exchanging needles. And we also provide a list to our participants of primary care physicians in town that are friendly and non-judgmental and will see them regardless of their drug use. And so that's really another important service that we provide.
It's treating people like people. And that's something Dr. Leach
Yeah.
would always say, is that the team, if you treat people like people, they will respond with like people. And what does it mean to you? Knowing you worked with Dr. Leach for a long time, knowing that this commissioner, who was a former chief of staff to the U.S. Surgeon General, former Kentucky Commissioner of Health, that he launched this program and he died, unfortunately, of cancer before he could see it become the biggest success, or as big as it is and successful as it is. But the room that it operates out of is the Dr. Rice C. Leach Community Room. What does that legacy mean to you as you walk in that room every day?
Sure, it means so much. That room, when you're in there, you just get a feeling that his presence is all over that program. And one thing I can say about him is when I started at the health department, I started as a clerk in central registration, checking people in to see the doctor. But he always treated me with respect, and he treated everyone that way. He wasn't up on a pedestal, and he was open and kind and one of the most generous men that I've ever met. And with his guidance and then the support of our current administration at the health department, it's been everything to keep this program open. A lot of people didn't want to see this program open, both in the community and at the health department. And it took some education along the way as well. Not only did we build our program around what people in jail and drug court were saying and getting all of that input from people who use drugs, but we also had to do education inside and let people know that when we start this program, it's not going to be people running through the hallways slinging needles at children. It's going to be the same people that you see every day that come in for STD testing, that come in for WIC, that come in for a food handler's permit. So it was all that. And he just had great vision and great timing, because that HIV outbreak happened in Indiana, and then we passed Kentucky passed the law to allow it, and we were ready to go. So it just, the stars aligned, and we've just done some amazing things with this program.
It's interesting. You talk about how the education internally, and even I was for this from the beginning, but even I had a light bulb moment. I had that just ding at the top of my head of who would be coming in, because we were so unsure. And I remember this clearly. One day, our business cards came in, and we advertised the program. From the best practices were to use business cards, because you could discreetly palm those, slip into your pocket, rather than carrying a big flyer or a poster around. And we got the call that had been dropped off down in our front mail room. I go down the elevator, pick those up, and the box I'm carrying has one of the little, just again, a tiny business card taped to the side of it. And I turn the corner to go back up the elevator, and I hear someone say, "Sir, excuse me." And I turn around, and it's this giant of a man. And I always emphasize that, because if I tell you somebody's a giant, I want you to understand they're a giant. I'm 6'2", about 220 pounds, and this guy dwarfed me. So if you're a Harry Potter fan, I always say this guy was Hagrid, all right? He was huge. And then this tiny voice just comes up and says, "I see that you're carrying a card there for the needle program. Can I get one of those?" I said, "Well, yeah, absolutely. Let me open these up." And he said, "My friends and I have been so excited that Lexington is getting this exchange. And I would love to be able to take some of these to some of my friends and help pass these out. Is that okay?" "Sir, I would love for you to. You're the first person to have done this. This would be fantastic." And he thanked me, and he said, "Thank you all so much for doing this. Thanks for letting us pass this word out." And it hit me as he walked away that he had no idea that I was going to be walking through our lobby with this box. He was already there. He was here for something else, and he just happened to be someone who needed to use our program. And that really, I carry that with me every time I'm down there, because these aren't those people. These are people. These are the people who work with us, who sit next to us at places of worship or at ball games or movie theaters or concerts. They're in line with us, socially distant, I hope, at grocery stores. They are our friends, our neighbors. And that meant so much. And that's when what you were saying, that these are people. These are our loved ones. It was an in-person moment of that, I get what John's saying. John, a couple of things too. We want to wrap things up to people. What do you want them to know most as we go into this 5 years of it's Dr. Humbaugh, our current commissioner, he calls it a sad success. We wish we didn't have to do this. But unfortunately, there is this issue. It is an epidemic in Kentucky, in this part of the world, in the United States. And even though it is sad, there's some tragedy, it's important. And people are changing lives, they're saving lives. What do you want people who are watching this to walk away from as we get ready to celebrate 5 years?
I think I just want people to understand that it's not about the needles. It's never been about the needles. It's been about building relationships and reducing stigma and doing harm reduction. The goal of this program is not to get every single person off of drugs. The goal of harm reduction in this case is just to stop the spread of disease. And so I want people to understand why we do what we do, but also celebrate with us that this many people are using this service, and these are all people who are taking a first step to improve their life and improve their health. And the more people that we can get to come in, the more testing we can do, the more naloxone we can distribute to save lives. It's all for the better good, and it's all a part of helping Lexington be well and making sure that we include all of Lexington.
John, you hit it on the head about what the purpose of this program is. So I want to leave everybody with, it's my favorite story to tell about the program. And whenever we do a walkthrough and we let people know about this program, I'll always share this. And for those of you who can join us on the 26th, that you'll get to see how this works. We're going to talk to staff. We're going to go behind the scenes to let you know. But understand that that's just a piece of it, and that it is so much bigger than what we can say on here. And it is there's so much more heart in it. So this is a story, this happened a couple of years ago. A coworker of mine, of John's, visited a store here in Lexington, and the person behind the counter seemed familiar, but the face couldn't immediately be placed. You know, one of those moments of where both people are like, I know you from somewhere, but without context, it just doesn't click. So when my coworker paid for her order, the worker looked at the card and said, you could tell that she recognized the name, and said, do you work for the health department? Did you work for the health department? She said, I still do. And the person said back, you saved my life. And went on to explain that they had used their needle exchange program. And during a visit, an abscess on her arm led to our staff getting them into immediate medical care. Now, we are not a medical facility here, but this was somebody the abscess, the wound, the open wound on their arm was so large and so prominent that that person needed help. They needed to get them into some medical care. And I remember that part so clearly because I am not a nurse. I am not a doctor, EMT. I talk about this stuff. I do not have a medical background. And I was one of the people they reached out to, that our staff reached out to see if we could come down and help this person. And fortunately, I was not available at that moment. And somebody with a medical background was able to go down and help. Because if I had gone down there and seen the bone sticking out of that wound, there would have been 2 medical emergencies. I would have been passed out on the floor, probably knocked my head open. But I digress. So this person, they had wound on their arm, terrible wound, got into medical care. A few weeks later, they returned to our program, back to our exchange. And my coworker said to them, I wondered where you were. I'm glad to know you're alive. So as this person recounted that story to the coworker, he told her, that saved my life. To have this stranger worrying about me, showing me that someone cares, it saved me. He hugged my coworker and then added this, I've been sober 6 months. So don't tell us that a needle exchange program doesn't work. Don't tell us that harm reduction doesn't work. It is amazing what a little kindness can do. So Lexington, join us in celebrating that kindness on August 26th. Join us in honoring that kindness. Join us in honoring and remember those who couldn't be here whether it's Dr. Leach, who has passed on, or people who have come into our program who have unfortunately not made it to this point. Join us in celebrating the people who have gone on to those recovery programs. Celebrate the people who may take that step tomorrow or the next day or the day after. Whatever your reason is, join us, and you're going to see what a little kindness really can do. Thank you, Lexington. We look forward to celebrating with you 1:30 p.m. August 26th. On behalf of John Moses and all of his caring, wonderful staff, I'm Kevin Hall. Thank you for letting us talk about this program.